COVID-19 in kids. More Valley hospitals sounding the alarm about the influx of pediatric cases. We asked ABC 15 data analyst Garrett Archer to look at the numbers from the Department of Health Services. Those numbers showing within the past 2 weeks, more than 1 in 4 new COVID cases in Arizona is in the under 20 age group. This trend has Banner hospitals worried this morning. I spoke to their chief medical officer who went in depth about what they're seeing.
The youngest I've seen with severe COVID-related illness was 5 months of age and currently still being admitted to our pediatric intensive care unit with respiratory failure from COVID infection.
Troubling signs at Valley hospitals, children's hospitals, where COVID cases are increasing at an alarming rate. Dr. Anthony Ani is chief medical officer for Banner Children's Hospital at Desert, formerly known as Cardin Children's. How discouraging is that to see now kids seemingly more impacted by this current wave?
It's quite surprising to us. We're seeing in this iteration of the COVID surge, children now be more affected than before. We didn't expect to happen. It's like, here we go again.
This time, a shift from earlier in this pandemic when the elderly were the most vulnerable. How heartbreaking is that to now see so many of these kids severely ill?
It is difficult for those children, especially with their families too. Nobody likes to see a child suffer or be very ill.
Dr. Ani tells me he's seeing it in kids of all ages. He mentioned that baby that's currently in the ICU, but he says the serious cases can impact anybody from newborns to teenagers. His advice: wear a mask when you can, social distance, and if you're eligible, get the vaccine.